Osteoarthritis, can Pilates help with that? And what other things can help if you have osteoarthritis? So, osteoarthritis is a condition that causes joints to become painful and stiff, and it is the most common type of arthritis in the United Kingdom. Hello, and welcome to this presentation. I am Sarah Jane Walls, and I'm the Clinical Director of the Rehab Hub in Glasgow, which is a specialised Pilates reformer studio, physiotherapy and musculoskeletal podiatry clinic. So in this presentation, we are going to go through osteoarthritis, whether Pilates can help with it, physical therapy and other treatment modalities that can help. So signs and symptoms of osteoarthritis. So the main signs and symptoms of osteoarthritis really are this kind of pain and stiffness, possibly problems moving your joints, and you might have some tenderness around it. You might hear some noise, that kind of crepitus type noise. It's not always the case, and with osteoarthritis, you don't necessarily always have the pain there. You might just get wee bits of crepitus. So that kind of sound of the crackling of the joints. It really does come down to the severity of your osteoarthritis and the symptoms really do vary. So you could, for example, look at a person, say, for example, we had two x-rays and we were looking at the bones of, say, for example, a hip. And you could have one hip and the x-rays look pretty similar, and you could have one person who's in severe pain and the other person who's not got any pain, but their symptoms look similar. So it doesn't always correlate to what maybe an x-ray would show, and actually we wouldn't, getting an x-ray wouldn't generally be something that you would be doing, but we'll get to that further on in this presentation. So as I said, symptoms can be mild, but for other people they can be absolutely life-limiting. I myself had a full hip replacement in 2021 due to osteoarthritis in my left hip. It can be pretty miserable and can have a really negative impact on your normal daily health outcomes, and just having a normal healthy life disrupts a lot of things like your sleep, your eating. If you're on medication, it can be pretty miserable. Some of the side effects of them are grim. Now, what causes osteoarthritis? Basically just normal life. Your joints basically are exposed to this low level damage, but normally your body would just repair that and you wouldn't experience any sort of pain. But in osteoarthritis, the cartilage, this protective cartilage that's at the end of your bones, essentially breaks down, and you get this pain and swelling and problems moving your joints, and you end up in some instances with lots of bony growths around the area, and it can become really red and swollen and really sore. The exact cause, we don't know. But we know of things that contribute to it. These are overuse. This is why a lot like myself, I used to be a runner, I ran the Scottish running team. And when you've got at running at that elite or a sport at an elite level, and I see that particularly importantly because exercise, and particularly running is very good for you. It's a great thing to do, so don't be put off by running. What we're talking about is those athletes at an elite level, so they get that overuse injury, and that has been shown in research to increase the cause of osteoarthritis. You might get secondary arthritis that may have happened due to maybe you've had an injury, maybe you've had surgery, maybe you were in an accident earlier in your life, and it's more likely that you'll get what's called secondary osteoarthritis or arthritis. It might also be from damage from something where, like rheumatoid arthritis, so where it's more an immune system response, and also gout. So you've got this inflammation, this crystallization in the joints. Primarily, you get gout in the first metatarsophalangeal joint, so your big toe. So all of that can leave you with secondary arthritis. Your age also increases your risk of arthritis, so the older you are, your higher your risk, and that goes for many things. As we get older, we're higher risk of most things. And it just means that you're more likely to have it if you've got a family history, because it does tend to be hereditary. But we haven't identified the gene that is responsible. So we still don't fully know if that is the case, but there seems to be this correlation, but we don't actually have the evidence to support that. Being overweight, if you are carrying more pounds, it will absolutely increase your likelihood of causing osteoarthritis. And unfortunately, being a woman, our hormones, and especially perimenopause and menopause, we are more likely than our male counterparts to develop osteoarthritis. Diagnosis. So essentially, if you were thinking, have I got arthritis? Generally, what you would usually your first protocol, if you've not been diagnosed, is your GP. That tends to be where you go, but it depends where it is. So if you've got, you could see physiotherapy, you could also go see podiatry. So if it's anywhere in your lower limb, and get your diagnosis that way. You do not need to get an X-ray, and I really will say that again. There is no indication, no need to get an X-ray to diagnose that. Getting any sort of medical imaging usually would be used when we're trying to differentiate something. So we're maybe ruling out something else other than osteoarthritis, and that would be very much dependent on your symptoms. There's maybe something there where we are unsure if that is the case, so that would generally be an indication where we might send you for imaging, but it isn't something that ordinarily you need done, and you don't want to be subjecting yourself to radiation if you don't need it. So it's not something that you necessarily need. Generally, if you're over 45, that's your GP would normally look at that. As a healthcare professional myself, that would be, in the back of my mind that, what age is this person, and taking the whole history of you into consideration. It's not like as soon as you're over 45, you would just say, oh, it's osteoarthritis. That is not what your healthcare professional's doing, but it is a factor in that overall presentation of how you present, that full history of you, your full medical history, all of the background information that you're giving us about your condition, your pain, and everything that's going on. Every question that we're asking you that for a reason, to build that picture, to get your diagnosis, and then from there, a plan. Things that we will look out for osteoarthritis is we'll ask you questions about when you get the pain, when's it worse, how long does the pain actually last for? And generally with osteoarthritis, when you move, it actually dissipates. It's when you stop moving usually that the pain is quite high, and you get up and move and you're like, oh, you're just in agony. But then when you start moving, it starts to loosen out. It's almost like you're like the Tin Man that just needs that oiling and getting going. So if the pain starts to dissipate when you start moving, that's generally a sign of osteoarthritis. If your symptoms were different to that, then we'd be looking at other conditions, or we'd be ruling out other things and further investigations and possibly blood tests and possibly x-rays, and these sorts of things might need to be done, and we might be looking at something that's more of a rheumatoid arthritis background. But it really does, your first protocol, see your healthcare professional, whether that be your GP, whether that be a physiotherapist, whether that be podiatry, if it is anything from the waist down. So that's how it's diagnosed. You can see that your x-ray is not first line, right? It's not the main thing. It's the overall, these questions that we ask you. And the biggie is looking at that overall picture, your age, all of the things you tell us, and the questioning you about, the pain and when and what eases it, and these sorts of things give us the information that we need to then confidently be able to give you that diagnosis. Now, how do you treat osteoarthritis? Now, unfortunately, there isn't a cure. There isn't an actual cure, but hang on in there. there are things that you can do, and this is what I really want to do this presentation, because there is hope there. There are things that you can make your symptoms reduce, and sometimes actually gradually improve, believe it or not. And there are a number of treatments that can massively improve your symptoms, and especially if your symptoms are not in that really, really, if we're thinking about that pain scale of 10 being the worst pain imaginable and 0 being no pain, you're not up at the 10. If you're kind of in that grumbly 6, 7 or less, then these types of things can work really, really well. So things that you can get done, obviously we know things like joint replacement right now. That's end of the road. That's the last option. So when everything else has failed and you've tried physical therapy, you've tried MSK Podiatry, you've changed your footwear, you've possibly looked at maybe needing orthotics, maybe you're carrying extra pounds and we need to look at helping you lose weight. You've done all the other stuff. Surgery is that is the final thing. Obviously, that kind of medical model as well there. I know for myself, I was on a big mix of different medication, including things like naproxen. I was on codridamol, and actually had diazepam as well for some muscle spasms. So amitriptyline and gabapentin can sometimes be given out for these kind of things as well. And your GP is just trying to calm everything down, because if we can get you moving, if we can reduce the pain enough that we can get you moving, we know that that will be better for the joints. That's the worst thing that you can do when you've got osteoarthritis, is not move it. I know that you think, what, really? Yes, you're hearing that right. It's almost like what we want to do is we want to get the joints moving, and we want to kind of, motion is lotion, as I've always said, and we want to, it's almost like you're getting the WD-40 into the joint, so you need to move. So Pilates can be an exercise form that can massively help you if you've got osteoarthritis. Primarily us in the rehab hub in Glasgow, we get, oh my goodness, osteoarthritis is something that we see massively in clinic, and we've got a lot of services particularly for osteoarthritis. It is a personal passion of mine. Actually, my PhD is primarily dealing in rheumatology, so rheumatoid arthritis, but very much that is my special interest as an MSK podiatrist myself. I see mainly patients who have got either an immune type of arthritis, whether it be rheumatoid or ankylosing spondylitis, or but also osteoarthritis. So it's something we are very used to seeing here. And as part of that, we utilise Pilates, particularly Pilates Reformer, because of this extra support that utilising the machine can give you from that rehab perspective. It is a beautiful exercise form that will not put that strain in your joints that maybe other types of exercise may be just not doable for you. You're just, it can be a catch-22. We're telling you to lose weight, but you can't do the exercise because you're in agony. I totally get it. So Pilates can be an amazing amount of freedom for you with osteoarthritis, and can really, really help you. Now, other things that we have available and that can help you, so things like low-level medical grade laser therapy we have in clinic. So that can help with any inflammation around the joints. So with those bones, with the reduction in cartilage, we get this rubbing and this friction against the bones. This in turn then creates this inflammatory response, and we get this where you get inflammation, we'll get pain. So laser therapy can be excellent for that reduction of inflammation. And alongside that, I should say, is magnetotherapy. One of our latest treatment modalities that we have just introduced into the clinic in Glasgow is magnetic therapy. It kind of looks like a big MRI machine. It is getting amazing results, and we particularly wanted to invest in this type of machine specifically for the osteoarticular diseases, because we have so many patients where we knew this would benefit them. So things like inflammation, bone regeneration, osteoporosis, osteoarthritis, pain, it is the thing you need to be looking at. So if you have osteoarthritis, please do reach out to us. There's many things that we can do. The other thing which we see a lot, and primarily for knees for this, now we do anywhere from the lower limb for this. So pelvis down. We do lots of knee injections for osteoarthritis of PRP, platelet-rich plasma injections. And what that is we take your blood, we spin it down, and we inject the platelets of your blood back to the area that they're needed. Now, your platelets are the part of your blood that helps them regenerate, and the idea behind PRP is it is that regeneration of the tissue. Now, your body is amazing. It can regenerate, but what happens is as we get older, as there is inflammation there, we just get really sluggish at regenerating. So what we're doing with PRP, it's kind of like just a bit like biohacking your body. What I love about this personally is that it's not a drug, that it's not some foreign body that's going into your system. It's completely your own biological substance. It's not something synthetic, and it's that really there's very, very low risk with this. So the risk benefit ratio is very much in favour of the benefit over the risk, because there's no drug, there's no risk of damage via maybe a steroid, something like that, or which are very, if you're not aware, very much steroid is like napalm, fabulous for inflammation, but it does pretty much leave those tissues less healthy in the long run, so it's not something that you'd want to be doing first line. Other things that we have are things like Ostinel injections. Now, we really see the advantage of the Ostinel injections, again, the knee, but also osteoarthritis in the big toe. So if you've got, big toe osteoarthritis it's really, really sore. So Ostinel injections is actually hyaluronic acid, and it's not the same stuff that gets put into your face. This is particularly for joint injections, and we have Ostinel injections available here, and it's basically what what's happening, or what the theory behind Ostinel injections is we are essentially putting in a lubrication. So we're putting in a kind of replacement of what's called the synovial fluid around your joints that essentially you will have lost because of the breakdown of the cartilage. So what we're doing is we're essentially putting in a buffer. We're putting in this buffer. Now, it doesn't last forever, but certainly you'll get a good 6 months of relief from it. So it's a maintenance thing. And I should say that as well, that it is with PRP, it's the same. You would normally have 3 injections monthly of PRP every month, and then you would usually top up, usually maybe once or twice a year. And they're not overly expensive. You're certainly, under the 150 mark for all of these injections. So it's not overly expensive. So that's certainly, but it's a maintenance thing. It's kind of like it's not going to, as I said earlier on in this presentation, nothing that we're doing is going to, there isn't a cure. What we're doing is we're allowing you to possibly not need to go on medication, pain relief. You're maybe not having to take amitriptyline, or maybe not having to take tridimol. You're able to do something else that's a bit more natural, and it keeps you out of pain for a period of time, and then you have to eat. It's like, I suppose, just having to look after this deterioration. PRP, we get really good results with that, with the knee injections. It's pretty quick. Usually we combine PRP, especially for knees, we combine that with the shockwave therapy into that as well for the best possible results, because we're trying to get that body healing properties to start healing. And we do shockwave with it, and then give you an injection from there. So other things that you can do, like you're losing weight, we know that. Footwear is massively important, so please speak to us about that. Book a podiatry appointment. It's also worthwhile, honestly, if I'm being perfectly honest, is booking, if you've got osteoarthritis, booking a gait and posture assessment. What that will do will allow us to, why have you got this in the first place? It will really give us that, well, where's your weak link? How are you loading your tissues? And then what do you do about that? Because what we might need to do is offload those joints. There's maybe some tightness, there's maybe some restriction somewhere, and without giving you a proper assessment, a proper, movement analysis, so that full 3D biomechanics assessment and an MSK assessment with that, so that's your gait and posture assessment. We're kind of guessing. Anybody's guessing if they've not looked. So, we're to give you the best possible outcome, for a positive outcome, that's something I would recommend. So hopefully that makes sense. So treated osteoarthritis, we've just went through a little bit about that, but certainly the last line would be surgery. That's if your symptoms are really severe. Now, I told you I had a full hip replacement. I can tell you that I pre-rehabbed my hip. Oh my goodness, within an inch of its life. It really was the last resort. I waited until it got miserable. It got really dark in the final few months before I had the surgery. It was grim, so much so I was barely sleeping at night. And we all know you don't get a good night's sleep. We'll try that for the best part of 6 months, really not sleeping. It's dark. Arthritis is a horrible thing. It's that deep bone throb that just is like this low level toothache just there all the time, like a slow dripping tap, just draining you of your life force. That's what it feels like. That's maybe sounds a bit dramatic, but really that is how I felt. It was dark. It was very dark. Now, surgery has its place, and I can honestly say, having my hip replaced, it wasn't, and I'm still in my 40s. It was a devastating thing for me to have to do, but I reached the end of my road. I couldn't, and I was on a lot of medication, and by that point, I was getting all these side effects from that medication as well, and I just did not want to continue that way. To be honest, I had no option. I had to get the surgery. That is a personal thing for you. One of the great things that we do within the Rehab Hub is we have pre-op plans there as well. So no matter where you're at, we're able to support you and help you. So we've got so many clients that want to delay their surgery. They know that possibly down the line they're going to have it, but they're just not wanting it. Maybe they want to leave it until they're a bit older so that they're getting the longevity out of that. Whatever your reasons are, maybe it's you need to lose weight before the surgery. Everybody's got different reasons. Maybe it's we've got some clients in their 70s who are doing a lot of conservative treatments, things like PRP injections. We've got a lot of men in their well into their 70s who've got knee osteoarthritis, bowing of the legs, medial aspect of the knee, that inside part of the knee just louping, not able to play their golf anymore. All these things that just, you're meant to enjoy in your retirement, and think, good God, you can't do it. So what we work on with that is the rehabilitation, making sure the hips are strong, making sure that the muscles and everything around your tissue is working as best it can, making sure that we're offloading those knees to facilitate how you're loading. Usually with that, certainly if you're still active and you want to play golf or things like that, we'd usually put some sort of orthotic in your shoe, again offloading the knee. When we start to change how you load that tissue, we can offload the knee. So again, it buys you that time, that space, that pain-free motion. It really, we've got that at our disposal. And then things like PRP injections. It's almost like we're putting that WD-40 into the knee. Most of our patients are like, oh, it's great. It just gives us that relief. It just oils it all up. But also, really, what's happening in there is that regeneration of the new tissue. So that's really where the beauty is. So do not let osteoarthritis completely get you down and think that there's nothing that you can do. There are things that you can do. Don't give up to it. Keep moving. Remember, motion is lotion. If you need any help, if you are worried or need assessed or need some support, maybe it's knees, hips, whatever it is, come and speak to us, reach out to us. You can see the numbers there, 0141 363 0306. That's 0141 363 0306. And the web address is therehabhub.co.uk. We are based in Kinning Park, just near the BBC. We are just one street over from Pacific Quay, where the BBC and STV are. We've got free on-street parking, easy to get to in terms of public transport. You've got the train line. You really could walk from the SECC over in 10 minutes, just come over the Squinty Bridge. You can park right outside completely for free on street parking. You've got Shields Road or Kinning Park Subway, which are under 10-minute walk to our clinic as well. It's really, really easy to get to. If you know where the old News of the World was, which is now a big indoor trampolining centre called Rise, we are very close to that. We're basically just above Hydropool Scotland. So if you're looking for a hydropool, we're just above Hydropool Scotland as well. So it's pretty handy, really easy from the M74, the M77 and the M8, literally minutes from there. We're talking not even minutes. I would say from there about 30 seconds if you're coming off the motorway. So super, super easy, no matter what direction of the city you're coming from, with easy parking. You can't really ask for any more than that. But please do reach out. Don't put up with pain. There are solutions. There are options there. Have a great, a great week, and hopefully we get you